I'd like to present now Professor Gil Bolotin, who is the chair of the Israel Society of Cardiothoracic Surgery. Please, Gil.
Good afternoon, ladies and gentlemen. I will talk a bit about cardiothoracic surgery in 2015 and in the future. We have in this meeting change. Together with Amit Segev, we decided to have a more common work, cardiologists and cardiac surgeons together. And we have this year for the first time, two joint sessions. On Tuesday, a TAVI session with the Israeli Working Group for Interventional Cardiology and the cardiac surgeon tomorrow. And another session about echocardiography, again, Israeli Working Group and Israeli Society of Cardiothoracic Surgery. We have two distinguished guests for the surgical community. Dr. John Paskas from New York. He is the chairman of the Department of Cardiovascular Surgery in Mount Sinai, New York, and he's going to give two presentations. One in the joint session with the American College of Cardiology about hybrid coronary revascularization, a new treatment paradigm for selected patients with coronary artery disease, and the result of the PROAC trial, the Onyx, a mechanical valve that can function with less Coumadin and in the future maybe without Coumadin. Again, tomorrow morning in the joint session with the echocardiography tomorrow afternoon. I would like to thank two companies support his visit, Onyx and MTC from Israel. Thank you very much. The other guest is Roberto Lorusso from Brescia, Italy. He is the chairman of the Euro ESLO and he is the leader of the ESLO Global Chapter. And he is going to give today in the plenary session about the use of ECMO, the renaissance of extracorporeal cardiorespiratory support in the emergency medicine. I think it's going to be a major part in our common work, cardiologists and cardiac surgeons, the ECMO in the future for our patients. So I invite you all to come. And again, thank you for Gamida Company to support his visit. What new in our society? The big news is this photo on the right is from yesterday with the general manager of the Ministry of Health, AFEC, and with the help of John Paskas and Roberto Lorusso, we had a final meeting, and the Israeli Society of Cardiothoracic Surgery is going to work with a prospective database, STS-based, that will make sure for the future quality of cardiac surgery, and going to be one of the first countries in the world to have a governmental STS database. This will be assure the quality that you, cardiologists, are getting from your cardiac surgeon. I had the opportunity to work in 3 centers in the United States in the past and in few centers in Europe and in 3 centers in Israel. I know from my experience that the quality of cardiac surgery in Israel is very, very good. I think the database will show it in the future. I think this will be another part for us to work better with the cardiologists. I think the model of the HARTEM should be enforced in all our fields, and I really invite both cardiac surgeon and cardiology to work together in this tango. We actually need each other very much in the future. We start a collaboration with South Africa. Cardiac surgery of South Africa and Israel is going to have a resident and senior exchange in the near future, joint session in the annual meeting, probably next year already, and research collaboration. And according to what I heard, the cardiologists in South Africa would like to join as well. For the future, for the next annual meeting, I think that working together should be more joint session. This year we have TAVI and echo. I hope that next year we'll have a joint session, both TAVI, echo, electrophysiology, heart failure, interventional cardiology, interventional coronary. I think this is the way to work in our common annual meeting. So I thank you very much for coming, and I think the word should be to work together. Thank you very much.